Our current healthcare system has so much of our economic and socioeconomic inequity reflected in who's able to go to the doctor, who's able to afford a prescription, and who's able to get preventative care.
We know there's a disparity, and this is exacerbating it. Communities of color, minority communities, and poor communities don't have adequate health care and haven't for a very long time.
If you live in the rural parts of South Carolina, whether you're black or white, the reality of it is getting to a doctor is harder than it's ever been.
All this week, ABC News has taken an in-depth look at the racial and socioeconomic disparities stemming from this pandemic. We've shared their stories, families who've endured unfathomable loss, workers putting themselves at risk to feed their families and ours. This morning, we take a closer look at the many communities of color hardest hit by the virus, neighborhoods around the country, part of a nation divided.
Had she been anything but black or brown, I think she would have gotten the care that she needed. They would not have sent her home to die.
Francine Jefferson says that being a black frontline worker in Mississippi may have cost her sister-in-law her life.
All of them are considered essential workers, right? To feed America's families. Now her family is without their mother.
From the Deep South to the Midwest, from the Navajo Nation to our nation's capital, the global pandemic exacerbating long-standing inequalities in the country.
Second-class citizens. The playing field is not level, never has been, look like it will be.
In Washington, D.C., African Americans make up 46% of the population, but nearly 80% of coronavirus deaths.
When I saw that hypertension and diabetes and heart disease were conditions that were really making the coronavirus complicated for people, I knew that we had to be in communities where we saw those pre-existing conditions.
I met D.C. Mayor Muriel Bowser in one of the city's poorest neighborhoods, where she was touring United Medical Center, the hospital now ready to open up a new COVID wing, where ramped-up testing is being encouraged as well.
So we have been very, very focused on getting the word out to people about getting tested, isolating, and staying at home when they can. But we know so many people that have been affected by infection and death are doing essential work.
It really is just much harder to stay home. As you say, they're essential work.
All of us who are going to the grocery stores can ride transit or getting our trash picked up. When you look in Washington, those are largely African Americans who are doing that work.
Similar disparities in the Bronx, where Black and Latino residents are twice as likely to die from COVID than anywhere else in New York City.
I've never seen just a more overwhelming sense of desperation in my district.
City Councilman Richie Torres told our Juju Chang that social distancing in the projects he grew up in and now represents is impossible.
My maternal family has been living here for 3 generations. My mother's 60, she has hypertension, so you have to maintain distance from your own loved ones for their own protection.
Poverty takes a toll on the body.
The difference in life expectancy between the South Bronx and the Upper East Side of Manhattan is 10 years. So poverty's poison.
Almost every patient that I saw that was COVID positive was Latino.
In Chicago, Dr. Marina Del Rios works the front line of this crisis.
In the minority neighborhoods, especially, the number of positive cases is twice and sometimes even 3 times the number of positive cases that we're seeing in white, more affluent neighborhoods.
Del Rios told our Deborah Roberts, we're seeing the impact of healthcare systems that have been mistreating minorities for generations.
When a person of color walks into a hospital, are they already at a disadvantage?
There are multiple studies that have demonstrated that when you're a person of color, you are more likely to be triaged as less urgent for similar illnesses as a person who's white.
Back in D.C., a sense of urgency to right some historical wrongs. I've heard you talk about
having local and national leaders really look at the African American community and saying we have to address this health problem?
Well, it's more than health, right? We have to look at the building blocks of health. Having safe housing, having access to clean water, having access to good food and quality education and good paying jobs. Those are all of the things that lead to a healthy community.
So many people working to solve this crisis.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.